Hello again. Thank you for your previous presentation, and I would take it from there. It's not similar to physics, but as a child, I've been thinking that I've been watching science fiction movies that would it be happening in the future? Would it be able to use that kind of weird technology in our instance of surgery? So this is a literature review done with my colleagues for the advancement and challenges in the application of artificial intelligence in surgery, whether it be useful to use or be unsafe to use among patients. So nowadays, AI is the main talk about everything. Everything we use in life is AI included. So AI mimics human intelligence and specifically in decision making, and increasingly adopted in diagnosis and surgeries as well. And using the AI aims to improve precision, efficacy, and outcomes as well. So a small history background that the thinking of AI used to be from 1950s. I thought it's more recent than that, but I was surprised when I dig deep and dive deep in the literature to find that AI been on table since 1950. And they started to increase the use of AI since 1980s to 1990s in expert systems in radiology and pathology to help to detect some kind of disease or some kind of pathologies. And nowadays, the machine learning, the natural language processing and deep learning is taking a big part of the cake in terms of any field in life, especially in surgery. So the core domains of AI in surgery, we use it in three sections as a preoperative planning, in diagnosis and creating a 3D models, intraoperatively, guidance of a real-time imaging in artificial intelligence, and surgical robotics, that precision tools and nanobots that can deliver some drugs in some resistant cases. So to think about it, in surgery and rehabilitation, telemedicine, it's a task dimension or technology dimension. It takes from A to 3 in AI robotic system. So we use AI as technology to help us determine what are the pre-op, intra-op, or post-op usage during our procedure. And sometimes we go through that loop to reach the technology dimension that sometimes the AI itself can perform some kind of operations with the help of human factor indeed. So from my perspective or my surgical specialty, we could see the applications in colorectal, for instance, that the AI can detect while doing a colonoscopy. It can do polyp detection in virtual colonoscopy. In neurosurgery, can do tumor segmentation navigation that can AI help you to navigate where to reach some kind of brain tumors. In cardiology and orthopedic, that robotic and predictive tools can assist during cardiology and orthopedic surgeries. So in the previous slide, we could see that the AI in surgery can be into three parts: preoperative planning, so requirements, accuracy, automation, privacy, and speed that can be done. The challenges are the multinodal input, the patient diversity, complicated symptoms, less informed in diagnostic data. So these are the challenges that face an AI in pre-op. And sub areas like classification, detection, segmentation, and registration. While we go to intraoperative guidance, we could see that we need some requirements like the real-time precision and high resolution. But there are some challenging as well. Limited and low resolution input, tissue deformation, less visually accessible, and environmental variance. And the surgical robots requirement, precision, robustness, and real-time and safety. But there are some challenges as well. That accurate kinematics and dynamics modeling, perception of the dynamic environment, and high autonomy. So going to robotic assisted surgery, a system like Da Vinci, which is more popular and familiar now, that we use, can make it easily for one surgeon to perform the surgery from the main desk setting, not operating. So the surgeries that used to have like 4 surgeons, few assistants, and few nurses now can be done with one surgeon and with the robots. And as I mentioned before, that nanobots are now used for drug delivery in cancer targeting, and some robots now used to make it in a benefit of surgeons that they have suffer from tremors and give them better ergonomics for surgeons. So any surgeon with disability or any problem with having tremors, now they can use the robots to help them operate safely again. And in my deep search and my review of AI, I think there are some benefits of AI integration. So I got to 3 points. The first one is improved diagnosis and surgical accuracy. And you can personalize the treatment strategy, varies from a person to another. And you can enhance the surgical education and planning. So giving the AI within the robot will give us more various places to go for and explore. Although there are a few challenges and limitations, so ethical concerns, patient consent and data protection, and technological gap in system, and reliability of AI in prediction. So we can't make sure 100% that the prediction of AI would be 100% accurate. And we need a clinical validation. I need a vigorous clinical validation for using AI in the field of surgery. But there are future directions. The collaboration across discipline key. We need to focus on transparency and ethical frameworks using the AI, and real-world clinical validation required, an AI-tailored surgery for individual patients, and also a virtual surgical training used augmented reality. And we also emphasize the use of ongoing research promises a smarter tool and safer outcomes for the patients and the surgeons. And I have 3 points as a takeaway message that AI is transforming surgery across fields. Challenge remain, but are manageable, and surgeon using AI define future standards. And I have some. I've heard one of my colleagues that he's concerned about replacing AI plus robots will replace surgeons or physicians, but I'm not sure that will happen in the near future. We still need a human factor in surgery because you can't depend on AI and robots and everything as a patient safety. Thank you.